great access to healthcare in the minority community. For over 4 years, Minority Health Institute has maintained a commitment in providing access to free health in Huntington, West
Okay,
Virginia.
hi, my name is Vanessa Alada. I work with the Minority Health Institute. We are the hosts and organizers of this health fair today. Like our name suggests, the Minority Health Institute is concerned with the health of minorities in West Virginia. And when we say minorities, we mean people of color, members of the LGBTQIA community, as well as poor whites, because we all face the same inequities, which is access to health. The message I have for minorities is prevention really is better than cure. When you engage in good health behaviors, when you practice good health behaviors, you reduce the need to seek out clinical care. And I want minorities in West Virginia to know that prevention really is better than cure.
Thank you.
The fifth edition of the Hair Fair, organized by Marshall University Minority Hair Institute, took place last Saturday, September 30th, 2023 at Radar Park, downtown Huntington in West Virginia. The event brought the local population in Fairview community to benefit from different health services like the free vaccination, free blood sugar screening, cholesterol screening, and many others. A well-reputed health service like the Valley Hair were also present.
Hi, I'm Dr. Leanne Levine with Valley Health today at the health fair. We are a true community health center, so we offer family medicine, pediatrics, OBGYN, optometry, ENT. We have addiction recovery programs with the Mommy program that is amazing, part of my heart. We also have infectious disease. So today we're offering rapid HIV testing. We also can offer PrEP, which is HIV PrEP medication to help prevent getting HIV. It's a pill you take once daily. We have that on site if anyone would like to start that today. We're also doing hepatitis screenings, and if you know you have Hep C, we can treat in-house with Maverick within about a week's time.
So, where is the location? I know Valley Hair is located on 6th Avenue.
We have multiple offices around the area in the state. The office that I'm personally representing is on Highland office on 3rd Avenue.
Okay. And this screening that you are providing here today, how much does it cost?
We take insurance, so all insurances are accepted, and if you don't have insurance, we help you register for Medicaid.
Okay. Thank you so much for your services in the community like this one.
Thank you. And part of Valley too, we're also offering flu vaccines, pneumonia vaccines, hepatitis A vaccines, and hepatitis B as well today.
And this is the flu season. Tomorrow is 1st October.
Yes.
Right, so at the right time, you are there already on the spot.
Yes, we are.
Thank you so much.
Thank you.
Yeah.
This hair fair were not only limited to hair services, but other vendors who came out to share information on some of the opportunities, including college program, especially for the minority students.
Okay, can you just tell your name and who you represent here in this hair fair?
Yeah, so my name is Shaquille Harris, and I'm representing the Marshall University Social Work Department. And I'm here to really talk about our MSW and our BSW programs, as well as our Behavioral Health Center on campus.
Yes, some of these programs require high fees. Is there any scholarship for minority students who may be a little bit less privileged to have financial access?
Yeah, so we do have foundation accounts where we do have scholarships, normally separated in about $2,000 to $3,000 per semester, depending on the student in need. And then we also have another scholarship if they commit to working for the DHHR, or our Department of Health and Human Resources. And so every year that you commit to work for them, they'll actually pay for part of your tuition in our program.
So you have all the resources, all the handouts, and how can they locate the building, or maybe they're interested in the program?
Yes. Yeah, so if you're interested in our program, we have plenty of resources here. We have a QR code down here for anyone that they can scan. You can also just Google Marshall University Social Work Department. And when that comes up, I'm actually on their website. And so you can contact me. I'm the admissions and recruitment coordinator for the department, and I'm also a professor in the Master's of Social Work department.
Okay, thank you so much. And you say your name again was?
My name is Shaquille Harris.
Okay, thank you so much.
Thank you.
A lady who is a nurse told us how major hospitals around Huntington area like St. Mary Medical Center, Cabell Hospital and Pleasant Valley Hospital are merging to Mountain Health Network, and what that means and the advantages that it will bring to the patient.
Yes, I'm Patty Dickey. I'm a registered nurse and community liaison for currently Mountain Health Network, and that will be converting to Marshall Health Network soon. So that's going to give your patients that come to the entities of Mountain Health Network or Marshall Health Network, it'll give them larger, bigger opportunities to have more services available to them. So the benefit to the patient, if you're a patient at Mountain Health Network, is that you have more services, more availability of physicians, and more opportunity to have testing done. And they're in the process of converting their computer systems, so every system's going to talk. So if you're at one of our facilities across town, we're going to know what happened there if you're sent to a specialist on the other side of town.
So, if you may want to explain in lay terms, say, let's take a hypothetical situation. Say a patient come to St. Mary
Right.
and being diagnosed with something,
Mhm.
and later on you find out that there's no specialty at St. Mary who is able to take care, and he or she is transferred to say Cabell Health
Right.
or Marshall Health.
Our electronic health systems will be speaking to each other. We are in the process of converting to one healthcare record, HIPAA compliant, and we're in the training process right now of getting those speaking. So probably by the end of October 2024, we're going to have all those medical records converted into one big system. But now we can actually pick up the telephone and call our partners across town. So we have a benefit of that, but we also have all the radiology records will be converted, the medical records with the reporting. But until all that happens and the computer systems actually talk, we're going to talk by person to person by phone.
And what would be the challenge on the side of the clinician, like the nurses, the physician, the pharmacists, and the rest?
I think the challenge right now is getting everybody trained and getting the community, making the awareness of who we are and what we can do for our community. So the patients will know we have the services right here in the Huntington area for what they need, that we have many, many specialists and available services that we can offer, and they're not going to have to go out of town to the Cleveland Clinics of the world or Ohio State or UK. So as we make an awareness and as we work together, the challenge is getting everybody educated to what is available in our community. And health fairs like this, the Minority Fair itself, actually allows us to do that too.
Okay, thank you so much.
You're welcome. Thank you.
Yeah. Dear viewer, as you have just heard, converging and merging different health provider or health institution together will always benefit the patient. Technology always brings some advantages. However, there are shortcomings, like she said, will be the training. Once those doctors and those nurses are well trained into those programs, rest assured that they will provide the best benefit for you, and more also, and most importantly, access to healthcare will be to your advantage.
There were other vendors who were marketing themselves and giving away brochures about their company and organizations.
My name is Felicia White. We are here with our sorority, Delta Sigma Theta Sorority Incorporated, Huntington Alumni Chapter. We are here to do voter registration and also a library project, Seeing Black and Red, which focuses on African American authors and those books that have been banned by African American authors. So we're giving away free books and doing voter registration.
I'm representing Marshall University Department of Health Science and also the Men's Health Equity Institute, where we do all things men's health research, whether we're talking about chronic disease, prostate cancer, testicular cancer, just trying to make sure our men in the state of West Virginia are taking care of themselves and being proactive in their health. So thank you.
My name is Sarah Blevins O'Toole, and I'm the Director of Development for Branches Domestic Violence Shelter.
And you are here doing what exactly?
So we are here today representing Branches. Branches is an emergency shelter that operates both in Cabell and Putnam County, and then we also have outreach offices in Wayne, Lincoln, and Mason. And we provide all kinds of different services for people experiencing domestic violence.
We represent reproductive health rights and justice. So that is Love Your Birth Control program. So talking about contraceptive access. We talk about pregnancy options counseling. So abortion, adoption, and choosing to parent. We do lobbying in the state legislature, encouraging people to get registered to vote and to vote. So we do a little bit of everything.
Why do you decide to do this?
I think that it's very important that people have access to all the best information so that they can make the best informed healthcare decision for themselves.
To my right, we have Walgreens. They're doing free flu vaccinations. More about their vaccinations. And we also have Valley Health over to my far right with Dr. Levine, and her team is over there, and they'll explain more about their services too, as well as the other businesses and organizations will explain.
It was a sunny Saturday and people were thirsty and hungry. But good enough, there was a lady with her mobile kitchen where she was selling hot dogs and tacos. Adding that, the new restaurant will be opening soon in Huntington.
My name is Mary Jane Crawford, and I'm representing Nemesis Kitchen and Catering Services.
And I'm seeing that you say it's coming on soon. When exactly is it coming on?
October 9th. It's a Monday, 2 weeks from now, or a week from now.
And where will you be located?
We are 412 9th Street. It's in the 9th Street Plaza between the library and the Huntington Junior College of Business.
So it means people can buy and carry out. Is that what
yes.
you mean? And people can still eat in there?
Yes, we do have tables and chairs, so you can sit down and eat if you like, but everything will be prepared to go because we're doing the to-go lunches daily. But like I said, if you want to sit down and eat, you're more than welcome to sit down and eat.
Or what would be some of the main menu, some of the main dishes that probably you will be providing?
We are serving comfort food, so we'll have things like meatloaf, baked chicken, smothered chicken, turkey wings, baked fish, macaroni and cheese, mashed potatoes, greens, green beans, stuff like that.
Okay, thank you so much. And you say again you are located at?
We are located at 412 9th Street in Huntington, West Virginia, 25701.
All right. Yeah.
And lastly, the coordinator of the health fair gave her a praiser.
So today was a little bit different, unlike the previous year. It was more activity rather than just focusing on the healthcare or providing healthcare. Was that the intention to bring a little bit more services to the community?
Yes. So this year, I wanted to put kind of a twist on it. I wanted to draw in more youth to this fair to start preventative care. And that's kind of what we do at the Institute. We want to start with prevention, research, health promotion, and then outreach. And that's why we have these community fairs, is to outreach different communities. And I always tell people, if you're not the majority, more than likely you are the minority. So this year we had different vendors and different sponsorships. For example, we had CJ Hughes that did a silver sponsorship, which is over $1,500 they donated to this healthcare initiative. And they are a construction company. And so I wanted to kind of let them know about our livable housing project that we're doing throughout the state of West Virginia to focus on mold, mite, and dust mites and all kinds of healthcare hazards that people are actually living with in their home. And so they saw that and they wanted to do something more in minority communities, which started this continued partnership with construction going into minority homes and clearing the homes of asbestos, mold, house painting, and things like that. So that was a different take on this health fair again too. We also wanted to partner with hospitals. So we have Mountain Health Network here this year because they want to tap into more minority communities because they are in the heart of the minority communities here in Cabell County, specifically Huntington. They're in the heart of minority communities. So it's very important to have them here too and see how important minorities are in kind of combating health disparities as it relates to minorities and underserved populations throughout the state of West Virginia.
Yeah, because actually I saw there was a physician, a medical doctor from Valley Health, I believe, that was also here.
Yeah, so Dr. Levine, so she is with Valley Health. Valley Health, they are actually located right in the heart of minority communities. So it's important that these organizations come out to these health fairs, come out to these communities, so these communities can actually know who they are and that's how you're going to build and foster trust and foster that unification of doctors and physicians, getting to know who they're serving. They're in our community, so why not come to the health fairs to let people know who you are? And it's amazing to have Dr. Levine come out here and let people know, hey, I'm in the heart of your community. Why not come out here and show your face and get involved with community partnerships and community in general as a whole. So I was happy to see her and other physicians that were out here to support this minority health fair.
Yeah, and of course, Unicare. I think
Yes.
in the previous year, you have some sponsorship or some partnership working with Unicare. If I may want to ask you, how is the relationship going with Unicare?
Yes, so the Unicare relationship is so important. It's amazing. The president, Ted Haynes, he is amazing. And so Kim and Natalie Robinson actually reached out to Dr. Ward and I because they saw our first annual inaugural Minority Health Fair in 2018. And the next year, she saw it again. And she wanted to know, how can they get involved with our health fairs? And so that led to the $1 million community investment grant, because they saw the good work with just me and Dr. Ward were doing at the time when we first started out with the Institute at Marshall University. So our partnership continues to grow. We continue to get more partnerships because they see the initiative that we're doing around healthcare disparities throughout the state of West Virginia. So we love Unicare. We thank Unicare so much because our vision and mission is growing. And without them, our vision and mission would not be sustainable. So they're all about sustaining the Institute to years to come and to provide employment for people that want to do the good work that Dr. Ward and I have started. And so we've been able to hire 3 more community outreach workers, health education specialists to see the vision come alive. So without Unicare, that would not be possible. So we're really happy with that continuing partnership with them.
Finally, we have come to the end of this health fair. And this is Ernest Kumba reporting for Gaza Media. And this is Community News here in Huntington, West Virginia.